If you rub your eyes, listen up because this video is for you.
Missing someone.
Hello and welcome back to my channel. My name is Dr. Sarah Blackwelder. I am an eye doctor practicing in Austin, Texas. And on today's episode, I want to talk to you about eye rubbing. I need a name for these episodes. I don't know what to call them. I don't know. If you have any ideas, please let me know. I think these early videos are going to be really fun to look back at one day. Maybe embarrassing to look back at, but anyways, let's talk about eye rubbing. If there is one habit that I could pick for you to break, it would definitely be rubbing your eyes. Eye rubbing can have so many detrimental effects to your eye health, so it is important that you stop. Why is rubbing your eyes so bad? Well, first, eye rubbing can damage all of the tissue on the front of the eye, both the lid as well as the cornea. Your lids contain really thinly elastic tissue, and by rubbing that tissue, it can actually cause the lids to lose their elasticity, making them become more floppy and lose their ability to stick to your eyeball. Over time, this can result in something called floppy eyelid syndrome, which can increase your risk for issues like dry eye and corneal abrasions. Eye rubbing also damages the cornea, and the cornea is the clear window on the front of the eye that refracts light into your eye and onto the retina. If that cornea is damaged, it can result in reduced vision. And again, eye rubbing, if you are knuckle rubbing like this, can damage that cornea. The cornea is made of a network of collagen fibers, and we know that hard eye rubbing damages that network of fibers and is linked to a condition called keratoconus. The cornea, which has thickness like a book like this, is required to maintain a certain thickness in order to preserve its structural integrity. If it's too thin, it has the possibility to collapse and can be a problem. Keratoconus is a corneal condition in which the cornea starts to progressively thin. We think it is a result of both genetic and environmental factors, and one of those environmental factors is eye rubbing. So if you are rubbing, it can definitely accelerate the process of your cornea thinning and eventually can result in the need for a corneal transplant if left untreated. Now, for keratoconus, we actually have a surgical procedure called corneal cross-linking that is intended to prevent the progression of keratoconus or prevent this corneal thinning. So if you are diagnosed with keratoconus, I definitely would recommend asking your doctor about cross-linking. It is one of the first things I send all my keratoconic patients for because it is very low risk and the outcomes have shown to be very good in preventing corneal thinning progression. I always ask my patients why they're rubbing their eyes. Are you rubbing because they're itchy, or are you rubbing because it's a habit? If your eyes are itchy, it actually will do more harm to rub them because it releases more histamine. Histamine is the chemical signal that causes itching. So if you rub, the cells will release more histamine, which causes things to become more itchy, which causes you to rub more, and then you release more histamine, and this cycle just perpetually repeats. Although admittedly, I know it just feels so good to get in there and just rub. It is very satisfying in the short term, but in the long run, it is not gonna make your itching any better. A better solution instead for itchy eyes is to actually use an anti-allergy drop. My favorite is actually Pataday. It looks like this. You can get it over the counter at the pharmacy. I always have an extra bottle in my purse. As someone who is perpetually covered in dog hair, it is essential that I have it with me at all times. Another one is called Lasticaft. This recently went over the counter, so you can find either one of these at the pharmacy. I actually like all of my keratoconic patients to be on some type of anti-allergy drop, either Pataday or Lasticaft. I'd like you to use them on a daily basis to prevent eye rubbing. In conditions like keratoconus or any other ectasias of the cornea, it's just that important that you avoid eye rubbing at all costs. Another possible reason that your eyes might be itchy is instead of allergies, it might actually be Blepharitis, which is a buildup of oil and bacteria around the lashes. These excess flakes can fall into your tears and cause a lot of itching or irritation. So I definitely would suggest using some type of lid cleaner to regularly clean the lashes and remove any of this debris that might make you feel uncomfortable. A few of my favorite lid cleaners, first is the Tear Restore Hyla Wipe. I really like this wipe. The wipes are really convenient for on-the-go use. You just open one up and it's already pre-packaged and moistened. The Tear Restore Hyalo wipe contains a mild concentration of tea tree oil, which is shown to be very antimicrobial, remove bacteria as well as Demodex, which are mites that can live in the eyelash follicle. So tea tree oil is a great thing to use to clean the lashes. And again, it's in a really mild concentration. It also has aloe to soothe and condition the eyelids. For more severe cases of blepharitis, I actually like a gel. The Zaku Shield gel is made from okra. Okra has actually been shown to be antimicrobial, and the gel I like because it's a little bit thicker and it coats and gets into the crevices of your eyelashes. So I really like it. You can also just leave this on. It's a leave-on formula. You don't have to rinse it off, which is great. If it's a habit, habits are a little harder to break. I might actually suggest using or wearing some glasses to prevent you from being able to physically touch your eye. So keeping the glasses on all day literally acts as a physical barrier. Contact lenses might also be a great option for some people because having the contact lens on, you might be more aware that there is something in the eye and less tempted to rub because you don't want to cause an abrasion or move that contact lens out of place or scratch or irritate the eye. Eye rubbing at nighttime also can be a big problem because people often rub in their sleep and they don't even know that they're doing it. If you have a spouse or partner that you sleep next to at night that can let you know if you rub your eyes in your sleep, that would be a great place to start. Wearing an eye mask when you sleep would also be great because when you try to rub the eye and you hit that eye mask, it might almost be a moment of clarity of like, oh, I'm rubbing my eyes, I need to stop. If you also sleep face down, or if you sleep on your hand or on an arm, kind of like this, that can also damage the cornea. Again, more important for patients who are keratoconic or who have other corneal ectasias or conditions, but that can be a cause for concern as well. Okay, so don't rub, but if you're gonna rub, here's how to do it. A lot of patients who suffer from allergies will actually get itchy in the inner corner here, and because you're not actually rubbing on the globe, the eyeball itself, you can rub in the inner corner or the carbuncle. Again, you really just want to avoid the eyeball and can kind of rub in this inner corner here. You can even just kind of press and apply a little bit of pressure, and that oftentimes will take care of or satisfy the itching sensation. Another method you can use is to try to tighten the lids so they actually apply a little bit of force. So almost like pulling the lid from one side, and if you blink really hard, that tightening of the lid and kind of forcing it to apply a little bit more pressure on the eyeball can also satisfy the itch. I hope you liked this video. I hope you found it to be helpful. I'd love to hear your thoughts in the comments below. I would definitely love to hear if you are an eye rubber or if this convinced you to maybe try to change or at least stop rubbing as much as you currently do. I think any improvement definitely helps. As always, make sure you like and subscribe, and I will see you in the next episode. Bye.